Good afternoon, folks. This is Andy Reese, Director of the Department on Disability Services. And I'm not sure if it is me or Grace, but I just lost our video from Grace. So I'm turning mine off. Ah, perfect. As I turned it off, I could see our interpreter, so I know that other people can. So I will go ahead and get started with our data. Okay. So we are still at 444. There were 10 people diagnosed with COVID during the month of September. Of those 10 people, 6 were vaccinated, 4 not vaccinated, and the 4 not vaccinated were all in their natural homes. So by placement type, there is no change from last week. So 9 people in host homes, 114 people in intermediate care facilities, 1 person in a mental health facility, 91 in natural homes, 2 in nursing homes, 4 in out-of-state placement, 41 in residential habilitation, and 212 in supported living. The one change that we did have this week is that we did have another death, although it is a death of a person who had COVID more than a year ago. But we will wait for the medical examiner to make the determination whether COVID somehow played a part in that. And that was a person in supported living. And so in supported living, well, I'll get to that in a moment. So in ICFs, the 114 people who tested positive for COVID represent about 38% of the people who were in ICFs during the last year and a half. Of those, 28 have gone on to die, but only 13 were confirmed COVID deaths, representing about 11.5% of people in ICFs who contracted COVID who then had a confirmed COVID death. In natural homes, the 61 people who've contracted COVID represent about 6.5 to 7% of people in natural homes. Of those, there have been 5 deaths, and all 5 were confirmed as COVID deaths, representing about 8% of people in natural homes who had COVID who then died from COVID. In residential habilitation, the 41 people who've contracted COVID represent just about 38% of people in residential habilitation. Of those, there have been 3 deaths, but only 2 that were confirmed as COVID deaths. So of people in residential habilitation who had COVID and had a confirmed COVID death, it would be about 5%. And then in supported living, where we did have 1 person who died, the 212 people in supported living who've contracted COVID represent about 22% of the people in supported living. Of those, there have been 23 deaths, but still it's true that only 15 are confirmed as COVID deaths, representing about 7% of people in supported living with COVID who had a confirmed COVID death. And so overall, the 444 people with COVID represent about 18% of people supported by DDA. Of that, 62 of those people have died. Only 37 of those are confirmed as COVID deaths, representing about 8.3% of people with COVID supported by DDA who have died from a confirmed COVID death. So in September, by placement type, we had 5 people from natural homes, 3 in supported living, and 2 in residential habilitation. And all of those people either had mild or no symptoms. We have not had a person who has required inpatient treatment for COVID-19 since April. So as I indicated, of the people who've had COVID, we have had 62 of those people who've died, including one this month. However, of those 62, 16 have been confirmed as not COVID related. And for 9, we are awaiting confirmation from OCME regarding the cause of death. So that leaves us with 37 people who have confirmed COVID deaths. And the last time that we had a confirmed COVID death was in March of 2021. Among provider staff, there were 5 additional people who tested positive. So the total number of provider staff diagnosed with COVID has been 732. 52 of these staff were reported by more than one provider, and we've had 10 staff who have died from COVID-19. Vaccination rates at this point among people supported by DDA, we did have a few more people, although in no category was it enough to move the percentage up. So we are still at 78% of people supported by DDA who have been at least partially vaccinated, 83% of people in host homes, 98% of people in ICFs, 62% of people in natural homes, 96% of people in residential habilitation, and 86% of people in supported living. Amongst provider staff, fully vaccinated staff, as of our report that we received yesterday, was 79%, keeping in mind that that's fully vaccinated, and the mandate is that everyone be at least partially vaccinated or provide documentation of a waiver by September 30th. Among DDS staff, 90% of our staff are fully vaccinated. And with that, if there are any questions that people have, please address them to everyone in the chat so that we can respond. As always, we do have our partners from DC Health here. Does DDS know how many staff are partially vaccinated at this point? No, because we don't ask that. We've asked just fully vaccinated. For provider staff, amongst our own staff, we do have that information. Although it's not in the statistics I track, but I know the person to ask for that information. And so just so people know, we will continue tracking the reports from the providers of the number of people fully vaccinated in their agencies. And beginning in October for our waiver providers, the provider certification review will include a review of compliance with the vaccine mandate. When is DC Health offering Moderna booster vaccines for persons that they assisted in vaccinating earlier this year? I didn't know that that was approved yet. Perhaps, I don't know if DC Health knows that. Nelson, are you aware of whether um, Moderna booster has been approved? My understanding was the only booster so far is the Pfizer.
To the best of my knowledge, Moderna is not yet approved as a booster. Do remember there's a difference between a booster for those that are indicated and an additional dose for those that are immunocompromised. That's something different. So a Moderna is available if in the context of an additional dose for someone who's immunocompromised, but that is different than a booster shot. Currently, the only approved vaccine for a booster shot is the Pfizer vaccine.
And for folks who did get Pfizer, if you go to coronavirus.dc.gov, you can get information about where to get your booster shot. And as I've said before, unlike when vaccines were first available last winter, availability of vaccines and accessibility is really no longer an issue. So people should be exploring that with their provider. As they would any other routine health care. I'm curious if DC Health has received this question. A staff submitted a letter from an attorney stating that he is following the Biden ruling that permits weekly testing for non-vaccinated, as that is a federal rule versus a local rule. Additionally, the letter has a statement that seeks a religious exemption, again from his attorney. Advice from counsel suggests this is still being argued in the court, so this puts us at risk. Does DC Health have a response? DC Health could probably say this. I think that the folks at DC Health who are considering waiver requests are not on the call today. But if there is someone from DC Health that would like to respond, all the stuff in the beginning of what they submitted to me seems irrelevant. They submitted a religious waiver request. And it does seem to me that your attorney should be able to comment on the authority of, well, I will tell you this. When our provider certification review is done, if you're talking about a person in a waiver setting, the district regulations require that person to be vaccinated or have a waiver. So that's how we would be proceeding. But since they've requested a waiver, we have in writing from DC Health that if they've requested the waiver, they're good until it's denied. Good afternoon. As I understand it, the day retainer payment has been approved by CMS. Yes, I think we announced that last week. If so, will there be any guidance issued to day providers as the best way to coordinate this with service coordination in the waiver department? Yes, there should be a transmittal going out providing the instructions. So the rates for the retainer payments were published when our new rates were published in July. And the guidance will be exactly the same as it was before, but the new guidance will be going out. A new transmittal will be going out, excuse me. What will happen to the service being received by a person served if one of a family members is the support staff and the family refuses to be vaccinated? If family is being paid as a direct care person, as a DSP, or if they're being paid to provide service and they're providing direct service, they have to be vaccinated or they can't be paid. And so you would have to find another person to provide the service who either is vaccinated or has met one of the waivers to vaccination. Will DC Health notify providers when an exemption request is denied or approved? They're not here, but my understanding is no. This is a brand new process that's been put in place. And so it may be as implementation moves forward that things will change, but the individual has the obligation, and it is the individual who will receive the notification from DC Health. Given that this portal to submit these requests has just been opened, I don't think anyone can predict how many requests they're going to get. So deciding how, making any statement about how long it will take them to make those determinations seems quite challenging so far. Does DDS know whether there are any providers who are choosing to institute weekly testing requirement for staff whose waiver requests are pending or granted? I don't believe we track that. We do know it in some circumstances, and we still have some providers who are doing routine testing of staff, vaccinations aside. And if I'm mistaken in terms of tracking it, Kirk, please let people know. But I don't believe that we're tracking that specifically, and that each provider is making their own decisions about a lot of these things. Is there a way for a provider to confirm a waiver request was indeed submitted to DC Health? No. However, there is an individual. So for any licensed staff you have, the person's going to have to, when they renew their license, be someone who is fully vaccinated. So that would be a way to know. For unlicensed staff, there really is no way to know, except that you could ask for a copy of what was submitted to DC Health, and at the very least, that a waiver request, that a valid waiver reason for a waiver request exists, in that the person has some record of a basis for a religious exemption, or they have some documentation from a medical professional who has said that taking the vaccine is contraindicated for this person. Is there a separate DC Health portal from where the attestations were uploaded that COVID training certification should be uploaded for licensed professionals? or should it be held for the time of license renewal? Someone here may know that. I'm not licensed in the district, so I don't know. I know that people had a deadline for completing that. I don't know what the requirement was about submitting that. I expect you could go to the licensing website to see what instructions they have about what you have to submit. Ah, thank you. Hold until the time of licensure for nurses is what Chioma has said. And Deborah Harris, thank you. It doesn't. So will providers be required to submit proof of vaccination of employees as it relates to monitoring from DDS/PCR/DC Health? So I can tell you as it relates to our provider certification review, when I spoke with Liberty about a week ago, it is they have a regular meeting each week at which they review any updated requirements for staff in the waiver, including this new requirement regarding vaccinations. And when those new requirements go into place, they monitor those in the same way. So, this is a health requirement that's monitored in the same way as other qualifications for staff are monitored, like the pre-employment criminal background, like the training requirements, the hepatitis B, the PPD for tuberculosis. So they would be monitoring the vaccination compliance in the same way that they monitor the compliance with those. So any provider that's been through a PCR review knows how that process works. Has there been any time frame given for determination of waivers? It will be really difficult to monitor on the provider without this. The provider certification review is going to look at whether there's something on file that the provider has. As I said before, sort of, building a brand new system where they have no idea how many waiver requests they'll get, suggesting that they could review all waivers within X number of days is just not possible because, as I say, they don't know how many requests will be coming in. I know, so the district government had until the 19th to be vaccinated. And so people had to submit those waiver requests from the district government, which are also reviewed by DC Health on the 19th. And I know that there were hundreds. And, this was a question at the mayor's press conference. I would encourage people to watch those press conferences and hear from any responses that Dr. Nesbitt provides there about sort of the status of those reviews. If Winslow is here, I don't know if there's any update regarding TME.
So I did speak with DC Health this morning, and they are still awaiting a response to the question. Apparently, there is a backlog of requests for information as this question has been out there for a while, but you know, we are still awaiting the answer from DC Health.
Do we have an estimated time on when the transmittal for the retainer payment will go out? Will service coordination be prepped for day to submit a lot of waiver authorizations requesting going back to January 1, 2021? This will likely get a bit complicated and confusing for day and service coordination. We'll need guidance on how to request waiver authorizations for retainer payments while also maintaining the authorization for services currently being provided. The authorization is for the day service. And so, for example, authorizations would be issued for the day services that are appropriate for the person. And to the extent the person receives the service, a claim is submitted for services provided. The number of hours that were authorized but not received because of the pandemic, a retainer rate is applied and a claim is submitted for the retainer payment. So it should be just the one authorization, and they should, although may not, be in place. So it would just be a matter of making sure, because they can be starting January 1 for up to 90 days of service in this year. Well, for up to 90 days of service in this year, they can be paid. And so the Appendix K that was approved was also for the additional supplemental payment for DSPs. There was some communication that went out very recently for there was some that went out very recently from DHCF because they had sort of the first payment, and then we included this as a second payment that's exactly the same amount. And so unfortunately, we had a meeting with DHCF that got bumped this week when we were going to address both of these issues in terms of the timing of these payments. So the transmittals should be going out soon, but I can't tell you right now. I don't want to commit right now to a particular time frame, but it should be quite soon. Many of the former authorizations are no longer in place. Authorizations based on service dates prior to COVID-19. I don't know what that means, but there will need to be authorization. There need to be authorizations in place starting January 1. And as I said, those authorizations would be for services that would be provided were it not for the pandemic. And Winslow may have more to say about that. Perhaps. So I can't give you a date regarding the transmittal going out, but I can tell you that we will have a more thorough response to all these questions next Friday. So this is Marcia Curry is sharing we would need a new prior authorization, as some people's prior authorization was removed since they were not active, especially if they had a recent ISP. They are non-active because of COVID. Correct. And if I'm not mistaken, one of the issues was as long as they had all of these goals in their ISP and the authorization, that was causing some issues for people of having to track goals that were not being worked on. I believe that's the issue. So for licensed employees who support someone under DDS that lives in Maryland, therefore the person has a Maryland certification and DC Health portal for attestation would not apply. What should we do? Keep in mind that the requirement for providers, for Medicaid providers, is still that the staff they have are vaccinated. There clearly is not a responsibility for a person who's a licensed professional in another state, working in the other state, to do anything about a license in the district. It is an interesting question. DC Health isn't here to respond. It seems to me it's an unlicensed person who's recording their status with DC Health. If the person is reporting that they've been vaccinated, I think that you as the provider having that documentation has you pretty well covered. But since DC Health has said that they want everyone who's required to be vaccinated to upload documentation, it seems to me that as a health professional not licensed in the district, you wouldn't upload to the licensed provider portion because, in fact, you're not a licensed DC provider. All speculation on my part. The most important, because I can tell you in terms of what we will be reviewing, is that if you have a licensed person, you do need to, if you have any staff who have direct contact with people and you are a Medicaid provider with the District of Columbia, and you're providing services through the waiver, when they do the provider certification review, they will be doing the review of the compliance with vaccination status of your employees. And so making sure that if they're vaccinated, you have their vaccination card. And if they say they've submitted a waiver, that you get a copy, or they've submitted a request for a waiver, that you have a copy of what was submitted so that you have at least evidence that there's some basis for them having submitted that request. Because I expect that is what our PCR team will be looking for. For the religious exemption, can the employee write the letter themselves, or does it have to come from their religious leader? We have only recently seen some guidance regarding review of religious exemptions. I know that some agencies have said that they are requiring that it come from a religious leader. I have not seen how DC Health has ruled on any of these. So, the person that submits something to you claiming that they have a sincerely held religious belief that prevents them from getting vaccinated, I'm not aware of anything that requires that come from any other source. So the challenge is going to be how that request based on their sincerely held belief is then vetted. And we really need to see, as I said, there have been hundreds of these filed for district employees. And so we'll be getting a good idea from the results of those of how the district is considering them. I know that we've also seen some folks there's EEOC guidance out there and people can refer to that. Could certainly check with your own legal counsel about what constitutes a sincerely held religious belief that would allow for a waiver. If an authorization for services for someone supported is to another Medicaid provider, I don't know what that means exactly. Is DDS/DHCF going to be verifying that they are, that they are vaccinated to maintain the authorization? No. So, the way I'm interpreting your question is, for example, if there's an authorization for some service that's not a person employed by you, but it's for like some licensed health professional. It's no different from the obligation that someone maintain their license by getting appropriate continuing education, by submitting their application every 2 years to renew it. And, DHCF has whatever process they have in paying claims for Medicaid that ensures that the payee is qualified to provide the service. So, this is no different from, there are no new processes other than this requirement to submit the vaccination information to the DC Health portal. But in terms of the oversight that we provide, it will be the same oversight in terms of people who are qualified to provide particular services. So whatever process has been in place to verify that historically, for other reasons, it would be that same process. But I have heard from DHCF, and certainly within our agency, I know what we will be doing. I've heard nothing from DHCF that they're starting any new procedure based on this requirement. Sawita said yes, but I'm not sure what that was in response to.
It was when you were clarifying what you believed her question to be.
Ah, okay. Thank you. Is there someone from DC Health that can address the question regarding proof has to be uploaded with a request for a religious exemption. Unfortunately, no, there is not. The folks who are here from DC Health are from the EPI side of DC Health. So I don't know to what extent it will be helpful for people, but I can tell you that, so I will post here. In terms of religious accommodations with the district government, the DC HR policies are posted online, and they do address the issues regarding religious accommodations, and they can be found at this website. And so, within the district government, as I said, DCHR is working closely with DC Health. So I think that at the very least, this gives you some sense of how the district is handling these. And I will say, we do within the district government have a form that is filled out. It's a DCHR form. And it's a form that existed before COVID existed, because there has always been the possibility that a person could be seeking a religious accommodation for any number of employment requirements that they had. So there is no specific form that someone is asking, where can we obtain the exemption waiver form? There is not an exemption waiver form. You would just submit a request for a waiver and explain the basis for the waiver. And as I said, I invite people to look at the DC website, which gives you an indication of how DC handles accommodation requests for religious reasons. Can there be someone from DC Health who can answer this question next time? I don't know. I know that in that particular area in DC Health, things are a bit tight right now in terms of personnel, so I don't know about their availability. And as I've said, this is a procedure that has just begun. And so, we're sort of, I saw, can we contact them for an answer? I can ask them. I think that some of these questions have been posed, and we've provided the responses that we have received. And I think that, as I said, I think that it will be very instructive to see how these religious exemptions are handled within the district government, to give you an idea of what the request looks like and how it gets handled. Is there a latest date for all staff or DSPs to be vaccinated? Well, everyone, the regulation spells this out and requires that everyone have their first Pfizer or Moderna vaccine by September 30th, which would then give them 3 to 4 weeks to get the second vaccine, or if they're getting Johnson & Johnson to have the one vaccine that is required by the 30th. And I will say, within the district government, we were required to have the vaccine by the 19th, and and across the district, employees were given sort of a 2-week grace period. And so, everyone has to have had it by the 5th, who doesn't meet any of the exemptions that are included for district government employees. And then we start with the necessary disciplinary action beginning on that date. And it's a process. I know you are not the professional in this, but might you know what the recommendation has been for someone who only took 1 dose and missed the second for over 3 months and now wants to get fully vaccinated? Actually, I think the DC Health folks that are here can answer that question. If someone had their first dose 3 months ago, although generally I'd say ask your doctor, but is there guidance on that from our folks at DC Health?
I don't think we have specific DC Health guidance, but the CDC has always said that for those, they give an ideal range of time between the first and the second dose. But even if that is missed, the options are to go ahead and get the second dose as soon as possible for an mRNA vaccine series, or the other option is to get a single dose of the Johnson & Johnson vaccine. And with either of those options, once 14 days has passed after the vaccine, they can be considered fully vaccinated. So that's kind of the current guidance, and to the best of my knowledge, that has not changed.
Thank you. So our general counsel has also posted the issuance for DC government employees for COVID-19 vaccination requirements, which you can find here. You can't really see that, but if you click on it, it will come up. It was the same thing when I copied it. The URL posts in a color that is really difficult to see. Or it's a color blindness test and I failed. And I do think all of our DCHR policies are online, and I think it's helpful to read them. They're instructive, at least, about how the district views these mandates and how it will be responding to them, given that it's the district that will hold folks accountable for it. And the guidance that Mark has posted includes proof and exemptions that providers can develop their own programs. so providers can develop their own programs. Have all of the people that we support been vaccinated, exempted? If so, why have they not returned to their programs? So exemption isn't really, at this point, relevant for the people we support. There's no mandate generally for the people we support to be vaccinated. I did speak previously about the fact that the Centers for Medicare and Medicaid Services have clarified that a Medicaid provider can impose a vaccination requirement on a service recipient. However, that does not change the state agency's requirement to still find services for the person. So there could be individual agencies that could have vaccination requirements. Why have they not returned to their programs? I think a host of reasons, for the same reasons, that we, so let's see, people who cannot independently remove a mask should not have a mask on. And all of us who are inside with other people should have a mask on. So, therefore you kind of draw the line there that if a person was in a facility-based day program previously, and they are unable to remove a mask, and masks are required there, it's likely that they and their team are not going to want them to be in the program without a mask on. This Delta variant is very contagious. And so I think that people who are not able to wear masks do need to be extra careful. People have choices about how they spend their days. In fact, we have seen finally some beginning uptick in these numbers. So the numbers are beginning to improve slowly. I think that every person and the people who love them and support them are going through the same kind of decision making that all of us are going through, making decisions about, do you go out to dinner? Do you go out to dinner in places where you're going to have to eat inside? Do you go to the movie theater? You know, are you going to continue using public transportation or figure out a way to drive your own car and pay for parking? I mean, all of these decisions are decisions that all of us are having to make. And so to answer that question for everyone would be impossible. What I can say is that each team should be inviting the designated day provider or whoever has been the day provider when they have these discussions, so that people can talk about excuse me, so that people can talk about how the person wants to spend their time, how they, what's important to them in spending their time during the day, what's important for them in terms of being able to, not be socially isolated, to be engaged in the community, to have social interactions, to have physical activity. And how are they going to accomplish that, either through their current provider or through the day provider or some combination of all of those? Since exemptions are only good for 6 months, I believe that's mistaken. They're good for a year. What happens if they haven't been approved by then, since they have no date to have them done by? Exemptions are good for a year. And so as the exemptions, well, up to a year. Because if someone got a medical exemption for whatever reason, and it was a medical issue that was only going to last for a specified period of time, I expect the medical exemption would only last that specified period of time. And once those exemptions have been granted, the waivers have been granted by DC Health, you will then be able to see the time frame of the waiver, keeping in, whether they're going to say you submitted it on this date, so you've got to submit another one year from this date. Or will they say we approved it on this date, and so therefore you have to, that'll be up to the person that approves them. But my understanding is they're good for 1 year. So staff would have to submit a new waiver each year. I have one last question, and I see that it's after 1 o'clock. So, and I might ask Winslow for assistance here. Are DDS service coordinators aware that virtual services recently added to the Appendix K? This says CMS August 18, 2021, as it pertains to day services. Was a training done or a training scheduled to clarify how to provide services remote while the person supported is at home? We understand the services must be person-centered and realistic in time. However, still would like to clarify how to bill for 2 services at the same time. But one thing I can say is it's 2 different agencies billing, and each agency is billing for the service that they provide. But Winslow may want to speak to the communication that went out to service coordinators about the ability to authorize remote day supports for a person who is also at the same time getting residential supports or companion.
Was a training done or training scheduled to clarify how to provide the service remote while persons supported are at home? And I'm not very.
I think the question is more for you. Do the service coordinators understand that this is an option and can authorize the 2 services at the same time? How to provide the services up to the providers.
Yeah, I just wanted to be clear about that. And so first and foremost, we did not do a formal training, but in individual supervisory meetings, the Appendix K is shared and changes are shared so we didn't do a training, just to be clear. If any provider is having a difficulty obtaining an authorization from a service coordinator, please feel free to call me or any of my management team, and we'll ensure that they understand. It is imperative that providers understand that even if we did train or explain, there may be someone who didn't clearly understand. The possibility exists that they don't follow through. So my number I put in the chat if anyone is having difficulty with that issue.
You'll have to type fast because it is now 1:05.
Well, it's 202. Wait a minute, hold on. Let me put it in real quick.
Yeah. And so I hope everyone has a good weekend. I will reach out to DC Health to see if some additional clarity can be provided regarding these questions about submitting things through their portal. And we will have a transmittal or clarification or both next Friday regarding the retainer payments that were in our Appendix K. Thanks, and I hope everyone has a great weekend.